Hello, it's Dr. Eric Potter again from Sanctuary Functional Medicine. We are using some new technology for our Facebook Live today, so hopefully sound is coming through, and if I happen to look over to the side, it's just to make sure everything's going smooth. So welcome. We're going to be talking on leaky gut and mold today, both as individual diseases and as they interrelate. So first of all, we are going to spend this hour starting with a quick introduction where I'll be talking for maybe 15 or 20 minutes about leaky gut and its relation to mold in general. And then we'll spend the rest of the time answering questions. We have a few questions that's already come in, but we will add to those as you, checking sound over here, which also let me know if everything's coming through. We will also be answering questions. You can send those in on Facebook, and we'll get those and try to answer as many as we can in the time we have. Do know that this is an educational session. This is not intended to be a time where I'm going to diagnose or recommend treatment for you. I can talk in general about things we do for patients, whether it's leaky gut or mold, but if you want that individualized treatment that we give here at Sanctuary, do make an appointment with us if you are a patient. If you're not, give Stephen a call at 615-815-5941, and he can talk to you about how you can become a patient, whether you're dealing with gut issues, mold issues, or other things. We would love to help you. So with that in mind, I'm going to start with a little introduction about leaky gut. With that, who may have leaky gut? Many people think, well, my gut's not really giving me problems, or I have symptoms, but I don't think they're really related to my GI tract. Well, if you have allergies, both sinus, wheezing, asthma, eczema, kind of skin symptoms, food sensitivities where you eat foods and they seem to cause symptoms, those can be signs of leaky gut. If you have autoimmune disease, lupus, rheumatoid arthritis, other diseases that are attacking your body, destroying tissue, Hashimoto's, which is attacking your thyroid, those can be related back to leaky gut. Now, of course, a lot of people will realize that irritable bowel syndrome might be related to leaky gut. We're going to talk a little bit about how much that may be true more than anybody realizes, but irritable bowel syndrome triggering diarrhea, constipation, that's relief of bowel movements, causes a lot of pain and cramping, bloating, a lot of discomfort. The other thing, polycystic ovarian syndrome or metabolic syndrome, type diseases like diabetes, all of those can do that in terms of leaky gut, triggers inflammation that spills into the liver, even causing fatty liver, non-alcoholic steatohepatitis, or non-alcoholic fatty liver disease, are things that could be starting or a leaky gut can play a part in. Now, if anything, if you're eating a SAD diet, a standard American diet, you're at risk for leaky gut. It's inflammatory. It has a lot of toxins. They can trigger issues. So know that if you're on that kind of diet, you could be at risk. Now, one more thing, neurologic diseases, Alzheimer's, Parkinson's, other degenerative diseases, cognitive dysfunction. You may have some leaky gut. Leaky gut goes along with leaky brain. Leaky brains lead to inflammation and symptoms. So, with that in mind, why would you want to treat leaky gut? We'll talk about how in a moment, but why treat leaky gut? Well, kind of in response to the very reasons I just talked about in terms of those that might have it is one, hormone balance. Yes, there are therapies where you can give a patient therapies that will treat their gut, improve dysbiosis and leaky gut, leading to balances in the hormones that they have not had. We see that often with patients. It may not be the only factor, but it may be one of the critical factors that if we don't address, we don't see balance. So polycystic ovarian syndrome can get better with going to gluten-free diet if you're sensitive to gluten. Now, not everybody is. That's why we look with a good history and consider lab tests to determine whether someone is sensitive to gluten and consider stopping that, or if you're having early diabetes, metabolic syndrome, and fatty liver. If your doctor has told you, oh, you've got fat building up in your liver, there's inflammation there, it may be the fact that your gut is spilling over chemicals, toxins, both from bacteria in your gut toxins from the food you eat, and toxins from our environment may be hurting the liver, causing the buildup of fat, actually even a high sugar diet, that standard American diet again, could be the thing that's causing you to have a fatty liver. So, and that fatty liver is a growing epidemic that can even lead to liver failure. Now, if someone has food allergies, if they're reactive to foods, it's probably because their gut's leaky. We want to get that gut cleaned up and prevent progression so that you don't have more and more food allergies. Then we stop it and turn the train back. And again, I mentioned leaky brain. We treat leaky gut because the same zonulin that causes tight junctions in the gut to deteriorate also can affect the brain, such that you can have more entry of inflammatory chemicals, toxins, infections, chemicals from infections, to treat Alzheimer's, to treat psychiatric disorders. In some of the studies, which if you're interested in looking at the actual research that I'm referring to, we're going to have that information up on our website in a blog post that tells you, oh, here's some articles where you can read about the science behind that they're starting to use probiotics to treat depression, anxiety, and some other conditions. Also, if you're suffering from inflammation, whether that's in the joints, whether that's just muscle aches, headaches, we can lower pain, lower joint pain with treating leaky gut. And again, if somebody has autoimmune disease, we want to lower the risk of recurrence of it happening in the first place, and we want to lower the symptoms of the diseases. Hold on one second. Can you tell them to be quiet? We want to improve that where you are not having so many symptoms from autoimmune disease, whether it's lupus, rheumatoid arthritis, Sjogren's, all the different ones that are out there. And if you have one autoimmune disease, you're at risk for getting another. So we want to try to prevent further autoimmune diseases down the road developing, so you don't get number 2, number 3, or number 4. And we do see that with some frequency in patients. So what is leaky gut? Let's talk a little bit about the anatomy, physiology, the science behind it, so you understand what we're talking about. The leaky gut implies that there's intended to be an intestinal barrier, something that is preventing things from getting into your bloodstream, into your body, after you've eaten them. Now, you thought, well, hold on, we've got to get nutrients and calories and so forth. Yes, it's a barrier that's selective, that lets some things in that are good and tries to keep things out that our body does not want. Now, really, this barrier comes in 3 forms: a physical, a chemical, and an immunologic barrier. The physical is kind of what we refer to the most because it's the epithelial lining cells, those cells that are the first layer coming in from the gut that block things from entering your bloodstream. They have tight junctions where they are tightly bound together so that you don't allow things to go between those cells, and then the cells themselves act as gateways. These are cells that are normally lining the GI tract. They prevent proteins, chemicals, bacteria, toxins, viruses from entering the bloodstream. We also have a physical layer, including a mucus layer that prevents bacteria from getting too deep or even too close to epithelial cells and getting inside. Also keeps out a lot of chemicals that way. And we have the immune system that then monitors things, prevents, if something does breach that initial barrier, the immune system can attack it, whether it's a chemical, whether it's a protein antigen from a bacteria or a virus, will try to attack it. That mucus layer, part of the physical barrier, also includes defensins, which are little chemicals that can attack infections. We have dendritic cells that interline in there that when they see, they'll reach out with little arms, literally little arms that grab a hold of things that look like danger, and will process that with the immune system. The immune system will send out cytokines to raise alarms, so that way that does not is not allowed to continue entry or to spread. Beyond that, you have secretory IgA, so antibodies that are secreted by B cells in the immune system that's circulating through the GI tract. Those antibodies are kind of the SWAT team that go out into the colon, into the small intestine, and attack things to bind them before they ever have a chance of getting in. So leaky gut, the technical term would be intestinal hyperpermeability. Basically, it's when this system goes wrong after some trigger. We'll talk about those triggers in a second, but zonulin, which is a protein in our body, increases. This loosens those tight junctions that are made of different claudin, occludin, lots of different proteins that it's not important to know the names of right now, but those are holding the cell together. Zonulin causes those to start loosening. Microscopic spaces develop between the cells. Protein, chemicals, bacteria, toxins, yeast, viruses can then potentially enter. You can also have a thinning of the mucus layer, whether that's dysbiosis is eating that mucus, whether your body, the epithelial lining cells are not producing enough mucus. Immune system can lower its guard if it's being suppressed by toxins. You can get the leaky gut, and again, leaky brain. So those triggers can be from endogenous chemicals, so histamine that your body makes if you have a histamine trigger reaction from mast cells. Serotonin. Our guts actually have more serotonin than our brains. Serotonin can be released from mast cells or other immune cells that can trigger some leaky gut. Then there's exogenous chemicals, chemicals from outside. So environmental toxins, so heavy metals. It can be plastics, it can be petroleum products, it can be mold toxins, which is one of the things we'll connect with later. It can be alcohol, gluten. Gluten can trigger some leaky gut in everyone, but in many who are more hyperreactive to it, it can cause severe leaky gut. Inflammatory foods with high sugars, with trans fats, anything that's triggering inflammation will potentially cause some leaky gut. Infections. One of the reasons we probably get post-viral diarrhea, irritable bowel syndrome, is the fact that those infections can cause enough inflammation, they cause leakiness that then gets perpetuated ongoing. So viral infections can do that, and some other bacterial. Nutritional factors, if you don't have the nutrients that your gut needs to stay healthy, can cause some breakdown. Your tight junctions can be downregulated by different types of things called histone deacetylase inhibitors or modulators of the enteric neurologic system. There's also the hypothesis that the hygiene, too much sterilization of our world can cause problems. If with the lack of farming, if you're eating sterilized food, your body actually needs some bacteria to stimulate it in the gut, the immune system, in order to build its defenses, kind of box around a little bit in practice. There's a lifestyle hypothesis that you have impaired function and diversity of microbiota, bacteria in your gut because of low fiber intake. Those are true factors. Endogenous factors like the hypoperfusion of intestine. If you have low blood flow due to some blockages, intestinal ischemia, that can actually cause some leakiness because it's, again, damaging your gut lining. High-end athletes, high elite athletes, actually, you can lower the blood flow to your gut because it's all going to your muscles, to the rest of your body, and it can cause some leaky gut. Some intense runners can actually get anemia because their gut gets so leaky they actually spill out small amounts of blood and lose iron in that. So hypoperfusion for good or bad reasons. Chronic inflammation, just chronic infections, chronic inflammatory foods, chronic toxins. Stress, so overworking, underresting. Trauma, so in motor vehicle accidents, people have a car wreck. The high amount of stress can also trigger some leaky gut. So that stress can be physical, as in a trauma, car wreck, overexercising, or it can be psychological, relational issues if you're going through a divorce, if you lost a loved one, if you're in a stressful work environment, all those things could potentially trigger some leaky gut. And then back to mold. There are environmental toxins. Mold can do a number of things. It can trigger histamine, which triggers leaky gut. It upregulates mast cells. To do that, where mast cells are immune cells, potentially in the central control of a lot of things on the ground. The sergeants that are running the show as you're battling. It can cause some increased permeability through inflammation and swelling of gut cells, gut lining cells. It can harm cells triggering leaky gut. It can disrupt the mitochondria, so that way your energy function of those cells is not working. It can also disrupt the gut bacteria. mold toxins, mycotoxins, are penicillin. It's a antibacterial. So a lot of those mycotoxins will actually kill off good bacteria in our gut. So then you can also suppress the immune system, leading to dysbiosis or yeast. Yeast itself can also trigger more leaky gut. So it gets magnified over time, more allergic reactions, more leakiness, more food sensitivities, more autoimmune, more inflammation. It just grows again and again. So we talked about the triggers, we talked about what it is and who might be interested in looking into the possibility of leaky gut contributing to their health. Let's talk a little bit about treating. So here at Sanctuary, we use the 5R program from Institute for Functional Medicine. We remove triggers, whether that's toxins, foods someone may be reacting to, sources of histamine in the diet. There are low histamine diets to be followed in some cases, helping people remove stress, remove toxins in their food. If they're eating pesticide foods, then they need to switch to organic or avoid foods that have high pesticide content. Then we want to replace enzymes. So we look at giving patients digestive enzymes. When you have inflammation, you have little villi on the lining of your gut, kind of like shag carpet. If you have inflammation or leakiness, sometimes those villi will shorten, and then the enzymes are more on the tips of those fingers, and you're not able to digest as well, and you have worsening. Whereas with digestive enzymes, many people ask, well, am I going to be, if I take them, will I become dependent? No, actually, if you heal your gut, you may be able to go off those enzymes and have better digestion than you did before. So you get better absorption of nutrients, lowers the risk of inflammation, and then you are getting healthier. We re-inoculate, so we weed, seed, and feed. We want more good bacteria, we want less bad bacteria. That's the weeding part, getting those out. So we use probiotics and prebiotics and symbiotics. Probiotics are simply the bacteria that we are trying to replace to get good, healthy gut flora again. Prebiotics are the food for them, like fiber-resistant starches. Symbiotics are a lot of fermented foods, giving you something that has both the pro and the prebiotics together. So let's talk just for a moment about how to do that. Fiber, green leafy vegetables, vegetables that have a lot of fibrous taste to it, carrots, broccoli, spinach, lettuces. There are a lot of things out there. You can go down the list, find it on the internet. Resistant starches are things that are not as fibrous, but your enzymes can't break down, but the gut bacteria can, so you're feeding them. Fermented foods can be great if you're not histamine sensitive or dealing with yeast. Fermented foods, the kimchi, sauerkraut, yogurt, kombucha, tea, things like that will actually help replenish your good bacteria. And then the next R is working on repair. Nutrients and herbs, things like vitamin A, C, zinc, vitamin E, omega-3s from fish oil, glutamine. There's some herbal things that we use, a product called Optimal GI Powder from Seeking Health. There's a lot of references. Again, I mentioned that there are references for these you can find on our website in a blog post, hopefully by the end of the day, where you can look up where people have studied and found that these things like quercetin, curcumin, DGL, zinc, polyphenols from foods and supplements, immune modulators, all show benefit. One of the immune modulators we use is something similar to colostrum, but it's Interrogam. Basically, it's a product that helps you bind the antigens and get rid of some of the bad bacteria as well. You can also use short-chain fatty acids like butyrate. Our body should make those from fiber, which is one of the reasons why fiber is helpful for our gut. But taking butyrate to get the gut lining to heal faster does show some benefit in studies. What you're doing is feeding the gut lining cells food they like. Butyrate is a short-chain fatty acid. It doesn't smell great, kind of the smell of rancid butter, but if you're giving your gut cells that, it makes them very happy and able to heal up and replenish where that leakiness is. The last R is rebalancing life. Again, we talked about stress. It can trigger cortisol and histamine release. If you're not sleeping enough, you can't heal. Your body doesn't go into a parasympathetic healing mode. If you're running in sympathetic overdrive all the time, that's a problem. Excessive exercise, again, hyperperfusion. Now, we've talked a little bit about mold, but let's shift over now. How is leaky gut different when you're dealing with mold toxicity or bowel toxin illness like Lyme or mold, or toxic algae blooms. Brown recluse spider bites can trigger that in some people. If you're swimming in the red tide at the seashore, not heeding the warnings, you can get a biotoxin illness. Mold is probably the more common. Mold and Lyme are the two most common. Leaky gut, gut issues in these patients can be more severe. They can have a lot more food sensitivities and a lot more severe reactions. It is most likely due to the higher mast cell activation. Again, mast cells are immune system cells lining all of our body in different places, especially mucous membranes, also in our skin, anything where our body's contacting the outer environment. They release 50, 100 different chemicals when they're triggered that then tell other parts of the immune system in our body how to react to an infection or a toxin. So this higher activation means more histamine. More histamine can be more inflammation, leading to more leakiness. So in this, we often have to use more therapies like quercetin or curcumin to counteract that, because it's more than you can just do with a low dose or what you can get in food. We may even resort to H2 blockers, pharmaceuticals normally used for reflux, but because they are actually antihistamines for the gut, many patients need that in addition to the natural therapies. And that's one of the things at Sanctuary we do is we don't close the door on all conventional medicines. If you want to, we will still advise you when we think a conventional medicine would be a better option, quicker or more effective in certain situations. But we will combine all of those because we're trying to get you better, and both at a root cause and a symptom level. So mold will also cause more yeast due to immune system suppression, so you'll get more leaky gut from that. It also requires longer time to see improvement. And sometimes you'll even see Epstein-Barr in the gut. Now, with that, we're going to shift over now to some questions, but I'll summarize the fact that leaky gut is when your normal barrier system, when you're putting so many things entering your body, going through the gut, it still has to be absorbed into the bloodstream. There's a barrier there, physical, chemical, and immune system that's all trying to keep bad stuff out while it's letting the good stuff, nutrients, calories, and so forth, vitamins, in. With that, when it goes wrong by a trigger, we talked about a number of those things, from dietary to toxins to infections to mold and other things. It can trigger a process that needs to be stopped, that has to be healed, so you don't have more and more inflammatory chemicals, toxins, infections, triggering then diseases from autoimmune to fatty liver to metabolic problems like hormone imbalance with polycystic ovarian syndrome to continue. But once you reverse that and address those issues, you see a lot of patients make great recoveries. So what we at Sanctuary do is, again, treat a healing protocol to get the gut to restore back to the proper barrier, to stop that inflammation spreading to the rest of the body, whether it's mold or anything else, and then see patients come back able to eat and enjoy life and not have these symptoms like you used to. So hopefully that was helpful for you. Let's move on to some questions. This is going to try to focus mostly on leaky gut, but any kind of open for mold questions otherwise as well, which is kind of a number of those that we've gotten so far. So let me start with one that we had from the leading up to things. So yeah, so mostly so far these are about mold. So let's just take these one at a time. What protocol do you recommend for CIRS, so chronic inflammatory response syndrome patients, as it relates to meds and supplements, such as the use of cholestyramine, activated charcoal, cognac root, glucomanins? So that would be asking, to some degree, what are the details if I was sitting down and going to paint a portrait for a person walking in the room, and then after I was done with that, going to take the next person that walked in that looks completely different and start painting them. Would I paint those two people exactly the same way? Now, I'd approach it with a systematic process, but in the end, each one would have a different painting. So with that in mind, that's how we approach our patients. Is it's not going to be locked into a one-size-fits-all where we do everything exactly the same. There is a ton of flexibility because each mold patient we see will have different symptoms. So we'll need to give them different symptom therapy and do different things for them rather than just say, oh, we're going to treat you exactly the same way as the last 5 patients that came in. So with that in mind, we are going to help. Number one, the most critical above all things is get the person away from whatever the bile toxin is. If it's mold, get them away from it. If it's red tide, get them away from it. If it's Lyme, hopefully they're not, avoid another tick, but back to mold for now, since that was what the question was looking at, was we're going to encourage them to do everything they can find where that is in their environment. If they don't, and they keep getting mold toxins exposed to them, then they aren't going to get more than just a little bit better. It is almost impossible to get someone fully better if they are still being exposed to it. Some would say it is impossible. So with that, first of all, get them away. Then we address other deficiencies. So we've looked at, done organic acid testing that tells, oh, this person's missing these B vitamins, or their omega-3s are low, so they need that because they have leaky gut, or we found leaky gut or dysbiosis. We're going to be treating those things and addressing nutritional deficiencies, preparing the patient for that. We're going to be having our nutritionist work with their diet to make sure they're eating healthy, as organic as possible and as low as possible on inflammatory foods, especially sugar, trans fats. We're going to work through that with them. Then we're going to look at what symptoms they have. They may have itching, sinus symptoms, hives, rashes. They may have more gut symptoms. They may have more headache, pain, inflammation symptoms, migraines, hormone symptoms. We're going to look through there because that's all going to play a part, whether it's balancing thyroid hormone, whether it's balancing B vitamins, whether it's balancing cortisol, which can also be effective with mold toxicity. We're going to look through those, and then we shift into the detox part. Now, this is an area where there's a lot of debate from between two of the bigger groups, the shoemaker and the non-shoemaker groups, in terms of what are the best binders. So a binder is something that you take by mouth. It goes through your body. Mold toxins get stuck to it in your gut. It doesn't get absorbed, but that goes through your gut. Your bile, your liver, and your gallbladder are pushing bile into your intestines. They will try to get rid of a little bit of those toxins. And that binder sticks to it, and you flush your toilet with a bowel movement, and it goes out, one tiny drop at a time. The debate is over whether cholestyramine, which is a pharmaceutical, is the only binder that is helpful, or whether other things like charcoal, zeolite, glucomanins, even Saccharomyces boulardii, a probiotic, whether charcoal, clay, all those things are other binders. Now, if you look in the agricultural world, there are clear studies showing that different binders are better at binding different mycotoxins. So this is kind of a broad lesson, but different mycotoxins come from different molds. One mold makes one mold makes another. With that, we have testing, which we don't use because we don't have testing that covers every type of mycotoxin. So our approach versus the use-only cholestyramine approach is we are going to use a mix over a period of time of those binders, from the charcoal and clay to the glucomanins to eventually the cholestyramine, and sometimes combining at the same time, sometimes doing those one or two, then doing that for a period of time, and then others. We'll also use things like glutathione, which boosts your body to detox, which you use glutathione to bind to some of those mycotoxins, and then flush out your kidneys. At some point down the road, we'll also discuss the possibility of using sauna. Sweating can get some of those out. Typically do not recommend that early on, just because many patients with mold toxicity, bile toxin illness, chronic inflammatory response syndrome, they don't sweat well. Their autonomic nervous system is not functioning well. So I'll avoid pushing that too hard until they're ready for it. With that, we will help them sort through symptom control therapy, sometimes detox. I will hear those who say, oh, detox should never be hard. I'm like, well, it shouldn't be hard, but it doesn't mean it's going to be a walk in the park. If you've got toxins in your body for 20, 30 years, no. Getting them out, well, yes, getting them out will eventually make you feel better. But taking out the garbage isn't always fun. and it usually is not. So we try to lessen those symptoms so people can do that as easy as possible. But if somebody tells you they can guarantee they're going to go detox you without causing you any side effects, find somebody else. I just be blunt about it. I just think it's ridiculous. With that, though, we're going to walk those patients through that. We'll monitor them, use different labs to the visual contrast sensitivity to monitor their progress. And over a period of few months, from 1 or 2 months up to 6, 12, sometimes even 24 months, as patients get older, they require longer periods of time because they've been exposed longer. We are working through to detox them. So we use a combination of things. And again, the biggest thing I want to emphasize is no more than I would paint two people's portrait the exact same way. I'm not going to treat 2 mold toxic patients exactly the same way. There's going to be some differences. There's no way around it that you can do some kind of a protocol that's always exactly the same. Another question is, what are your recommendations for a CRS, chronic inflammatory response syndrome, mold-affected patient looking for a new home? We've been trying to build a new home with certain precautions in place regarding air, water filtration, and mold inhibitors. So this is a great question. We are working through that ourselves right now. Still renting, but working on building a house. And from our own experience and from the experience of patients, helping them walk through that, learning from others, the shoemaker world and then the non-shoemaker world, it's the ICEA, the International Society for Environmentally Acquired Illnesses, would say these things. One, first of all, if you're going to stay in your home, you need to get rid of that mold, get you away from it, and get it out of your house. Usually that is possible. Yes, there are cases where a home cannot be remediated, whether it's been older, whether it's been in flood damage or multiple flood damage episodes. That can be times when, there is a time when you need to move. With that, though, if you're looking for a new home and you're buying a previously used, previously owned, somebody else has lived there before, you want to get as much information about any water damage they've had, any repairs they've made, any floods they may have endured in that particular location. With that, if you are hearing stories of leaky windows, leaky roofs, storm damage, hail damage, tree falling through, floods, you're going to be either wanting to think moving on to somewhere else, or you're going to want to really dig in and make sure whatever was done was repaired. There's no mold hiding behind things. You might look at using an ERMI or a HERTZ-2 test, which are Swiffer tests from some different companies that will test for mold. Remediators will tell you they're too sensitive. Well, if you're sick and have been sick for 10 or 20 years and your wellness depends on it, use a test that's going to pick things up pretty well. It's not a guarantee, but it's a good starting place to know whether or not that's a safe home. If the levels are high, you may want to mark that off your list, unless it's your dream house, and know that you're probably going to need a remediator to help with that once you start moving in. Beyond that, using a task, learning about the history of the home, is if you're serious about purchasing a home, or if you're building, let's talk about building in a moment. Purchasing, you will want to do a little more digging with an inspector, probably getting a mold inspector to look. Regular home inspectors will look around some for moisture issues, but if you're really concerned, I would recommend getting a mold inspector. They're going to go in and look, and oh no, behind this there was some mold, or there's some moisture issues here that were missed, or there's a crawl space, basement issues, which are other issues. Basements can be really bad if you're not taking care of them. There's higher risk of leaking. Crawl spaces can be another difficult problem. You say, well, should we live on a slab? Well, if that slab cracks, some shifting, and there's some water in that, we've had patients who have had slab houses that were a problem. So regardless, the big thing is you have to know that you're going to need to control that environment, put a little extra effort into it. So having a mold inspector, if you find mold, get an idea of whether it's remediatable or do you need to go looking for another house. Now, let's switch over. I could spend hours on details, and I'm not an expert. I can give you secondary both personal and secondary, working with patients and remediators, a lot of advice. But you need probably to have somebody, if you're buying a house and want to be safe from mold, having somebody, again, a mold inspector professional to help you in that. If you're building a house, you want to look at making sure that it's built well. If it's built too fast or they don't take the time to seal things, you can have a potential disaster, meaning that you move into that house and all of a sudden that water leaks in and you're starting to have lots of issues. You start getting sick again, and well, how could it happen? I'm in a safe house. Poor construction can cause big problems. You want to think about the crawl space, consider maybe partial encapsulation as an option, or there's some other treatments you can do. There's some chemical products out there that you can spray that have varying degrees of effectiveness, where they will kill and also give you guarantees, as long as there's not a flood or other major water damage, that mold will not grow under normal circumstances back in that area. We did use a product in our house that we sprayed during, before the drywall and after the drywall to kind of cover everything, to leave a coating. But there's several products out there you can look at with that. You want to make sure that your air conditioning system is controlled. And remember, the other thing I'll say is, don't forget, mold is not the only thing. It can be bacterial endotoxins. It can be particulate matter from all the dusting from drywall. It can be some of the plastics. Some of the things they use to seal things off is you have to control VOCs, volatile organic compounds. There's a lot of other things besides mold. At the last Shoemaker conference that I went to, even he said that mold was probably not the biggest thing. Water damaged buildings put out a lot of different toxins. So you want to have something where you keep things dry, whether it's encapsulating crawl space, whether it's incorporating a dehumidifier into your HVAC system, having air purification in there where it's catching mold spores or other chemicals, catching VOCs, whether that's the dust of construction or the dust of living in a house. You want to have a processes set in place where when you move in, you know it's good, but as you're living there month to month, keeping humidity below 50%, taking care of dust in the air filters. Don't be using things like using a wood fireplace is going to stir up a lot of dust. Lots of different things that you can do to keep the house safe, and then being diligent that you are looking out if there's a storm and a big loom hits this roof. You need to go up there and look in the attic and see, oh, is there any damage if there's drips? Or if there's a sink or toilet overflows, make sure you're looking at that quick and take it very seriously that it'll be fine, it'll dry out. No. Jump on it as quick as you can to make sure that there's no damage ongoing that creates mold later. So you want to do things that both prevent it from being there in the first place and ongoing vigilance on keeping that home safe so you don't have to look for another home or don't have to go through another remediation process. So one of our upcoming Facebook Lives will be a little bit more on mold in your home. So we will talk about that more in detail, and by that time I'll try to have a little more organized, instead of just answering your question, a little more organized, systematic approach to that. We've got about 20 minutes. I do want to pause for a second and just remind everyone, this is not about treatment or diagnosis. Can't do that through a video camera to a crowd of people. But I can help you understand your health, whether it's leaky gut, whether it's mold, help you understand it better so you know if you need to seek help, or you also just are empowered to take care of yourself in many ways. So hopefully this is helpful, but before you implement this, either talk to us if you're our patient, or if you're seeing another physician, talk to them about it before you implement therapies. So with that, the next is a question about, could you describe in layman's terms what the day in the life of someone suffering from mold toxicity might look like? This could help patients show their family it is real. Perhaps you could specify the degrees of depression, fatigue, malaise, and general well-being. Speak in third person, fixing what you saw and what you noticed and how deeply it affects quality of life. Fixing some people don't really believe it's a big deal. It would be wonderful to hear the actual symptoms and how they affect everyday life. How to differentiate it from other illnesses, or if that even matters. So with that, thank you for that question. I could spend hours. That's something I could speak from a very personal level in watching my wife and kids go through mold toxicity and recover from it. And at a very professional level of just watching hundreds now of patients recover, go through this process and struggle and are constantly diagnosing more weekly basis. So I want to save a full talk about that for some other ones, but let's put it this way in a few minutes. The person with chronic inflammatory response syndrome from a biotoxin, Lyme or mold, usually comes to our clinic after having seen multiple other doctors. They have had symptoms for months or years. That's part of the nature of the chronic inflammatory response syndrome. It's gone on for months. It usually began somewhat insidiously, meaning noticed some symptoms that just kept growing and growing. Occasionally we'll have patients who knew, oh, I moved into this house or I started this new job, and that next week, bam, it hit me. I woke up like a freight train was sitting on top of me. But most, it kind of builds up slow. They go around to different doctors. First, it's I'm tired. Oh, I've got an upset stomach. Oh, I've got some pain. Oh, I've got some joint swelling. It just kind of builds, and the first few doctors will be like, oh, they focus on that one thing. They can't get answers. It doesn't get, well, maybe it only gets a little better or it doesn't. But then they come back, oh, now I've got symptom number 3, symptom number 4, symptom number 5. And that's the other aspect of chronic inflammatory response syndrome. It's going to be multiple symptoms across multiple systems, not just the brain, not just the skin. It's going to be immune, brain, hormone, gut, detox systems, neurologic, allergic. It goes across different body systems, even heart and lungs, blood pressure, kidneys. With that, pretty soon the primary care doctors start saying, oh, this is beyond me. Let me send you to a specialist. The specialist has no idea that mold might do this. They look at their organ of specialization and say, well, it's not this. I can't find anything that fits into my conventional paradigm. So let's send you to a different specialist, and let's see who can maybe get their hands wrapped around it. So they bounce around patients with mold until they come back and say, all right, I've got to look outside the box. Then they often come to the alternative practitioners or functional medicine or complementary, integrative, whatever you want to call it, and start saying, hey, nobody else can find this out, determine what's wrong with me. Can you? And then sometimes they go through a few of those because not even all integrated functional doctors are aware or even capable of treating mold. It takes a little, it's a hard thing to treat. It takes a lot of hands-on care. And also it's, again, not, as I said earlier, everyone's different. Every patient's different. So it's not an easy cookie cutter. Oh, just do this protocol and you will feel wonderful. No. Yes, there's part of that, but there's so many individualities, personalizations to it that you can't do that. So even after seeing some different functional medicine doctors, they'll show up at our door and we'll sit down and we'll say, oh, yeah, you've got all these symptoms that you've been going on for long. You've had all these tests that have not found anything, which is the other part. We don't want to blame mold for something that your thyroid or something else is doing, but like, oh, these other things have been ruled out. Let's look, use some lab testing, a variety of lab tests to see if someone has mold toxicity. And then that patient, once we get that diagnosis and we sit down and explain it, patients are often like, it's like, first of all, the shock of just, could this be the answer that I've been looking for 20 years? Then the going back and then starting to think through things. My wife can tell you just her thinking through her life growing up, living in basements, living in moldy apartments through grad school, and how she felt sick at different times. And then we met while she was working at St. Jude Children's Hospital, probably some of the cleanest air you'll find in the world for the kids getting chemotherapy. She felt great, but we've lived in some moldier houses since then, and then she got sick again. So with that, they start piecing together things like, oh, I started that job, and 2 months later there was a leak in the ceiling, and I started getting sick. I started having allergies. I started this. A lot of people start piecing things together, and then some of the despair hits in because you're starting to think, oh, I've been sick all this time for something I could have avoided. I've missed time with my kids. I've missed time in work. I've not been able to do things. This has hindered me. The emotions start getting stirred up. And then mold patients have a lot of emotional instability. Their mood swings can be as crazy as can be. and they also have trouble thinking. So in the midst of your emotions, it's like turning the volume up on your emotions and turning the relay signal between your frontal lobe cortex, where you do your decision making, the calming, oh, it's going to be okay, from the, oh, I'm panicked, in the middle of your limbic system, in the middle of your brain, that gets turned off. So your emotions are all gas and no brakes. And you have trouble perceiving, so understanding things. You may have trouble remembering things, feel like you're getting Alzheimer's. You may have trouble misperceiving what others are saying. So there's a lot of relational issues because you can't understand if your spouse or other family members, and then they don't understand because they may not believe, as this patient said, whether or not this is even real, because it just seems like it doesn't make sense that one little thing could cause somebody to be that sick. But when we see patients who have been in that situation, can't think, the relationships are messed up, they're despairing, we give them a diagnosis, we start them on therapy, and they come out in a few weeks, well, really months to a year or two, they come out and they're smiling, they're gaining weight, they can eat more foods, their energy's better, they're going back to school, they're going back to their jobs. They're telling me how that they can start spending time with their kids without having to sleep on the, they can't get off the couch, and now, oh, I can get up and go for a hike with my kids. I see that. You can't tell me that it's not real. I see the labs get better. The very ones that we found were abnormal go back to normal. So the symptoms get better, the labs get better, a person's thinking get better, and they can even look back and say, oh, wow, yeah, I wasn't making sense. Oh, yeah, my emotions were a little bit crazy. And they can see that after they get out of it. But when you're in the midst of a tornado, it's hard to get your bearings on which direction is what, even which end is up. Once you come out of that, patients do get better. And yes, for someone who is watching a mold toxic patient go through this and wondering, well, why am I not sick? I'm living in the same house. Well, 3 out of 4 people, they have genetics where you can get rid of mold or break it down, the toxins, and it doesn't bother you. 1 out of 4 people, pretty much across most nationalities, it's really about 21 to 23%, 24%, depending on which study you looked at, can't detox, so that builds up and they get sick. So, you may look around you and everybody else may be well, and it's not you being crazy, it's the fact that you're mold toxic. So that is a little bit of what the day in the life is, going through not being able to go into a store because there's mold in the produce aisle. Being hypersensitive to chemicals, so you can't go into Target because there's detergent smells. You are trying to eat food, but you have to prepare one food meal for your family, but you can't eat it. You have to eat broth, or you're eating. You can only eat 3 vegetables and chicken because your gut's so sensitive to everything else. You don't sleep well. You can't think well. You're starting to forget things. You start then getting anxious about potentially having Alzheimer's. So it's a constant battle. And then even when you find out it's there and you're trying to find all the mold, it becomes a little PTSD, post-traumatic stress disorder, where you feel like mold is chasing you. From a spiritual standpoint, I would say, yes, I think it is. It is a manifestation of evil, and in fact, the way it affects people's health. And others will think, oh, you're just being paranoid. No. If you go into a building and you start itching, you start getting wavy brain, which some describe it as, or you start getting nauseated, or the fatigue hits you and you're sick for 3 days, it's not paranoia, it's self-defense. So those who downplay that need to listen and believe and give some benefit of the doubt for someone who's been sick, and give some compassion. So that's as much as I can go into. That'll be a topic that comes up again in other future Facebook Live sessions. Now, how does one get mold in their system? We've got, a few more minutes. How does it get one mold in their system? I'm assuming their body system. So mainly, probably inhalational, meaning there's mold toxins floating through there. You may smell mustiness, you may not. You breathe them in through the nose or through the mouth. In some cases, I'm pretty sure that it's going straight through the olfactory nerve, your smell nerve, and getting into the brain's blood supply. In others, it goes through your lungs, gets into your blood, and those toxins then build up. If you're one of those 1 in 4 who can't detoxify well from mold, from your HLA genes being bad, for lack of a better term, you will have that mostly through inhalation and through breathing in the nose.
The National Weather Service has issued a tornado watch.
So just turning off the tornado watch. Apparently you're having some fun weather here in this neck of the woods, but let me turn that off. As I was saying, your body can't get rid of it. Now, some people ask, foods, we have no studies in humans that show that mold toxins in foods cause problems, but we do know case reports and studies where it shows that people got sick from eating aflatoxins, or if you eat too many aflatoxins from peanuts, you can have an increased risk of liver cancer. But definitely in the agricultural industry is probably the biggest place. If you give pigs or turkeys or cattle feed that has high levels of mycotoxins, they have more infections, they have more endocrine problems, they have lower fertility, they don't gain as much weight, so you can't sell them for as much at market. They have less babies, so you're not reproducing as well. So we do know in the agricultural world, there are high enough levels, and they have set for that to see what is the safe level for different animals and different toxins and different types of feed. There's not been good studies. Hopefully there will be some of those in humans. So we do recommend patients limit exposure to moldy food. Eating a piece of bread with mold on it in the refrigerator is probably not going to hurt you. But if you are constantly eating things that have some mycotoxins in there, and there's a list of different foods out there, I'm not going to get into that list fully, but because I think inhalation through the nose and the mouth are probably the main sources. From mold, that, but Lyme, obviously getting bit by tick. If you're swimming in red tide out in the ocean, you're getting that more through the skin or other toxic algae blooms. Or if you're eating fish, they're floating on top of a lake. Not a good idea if you haven't figured it out already. If they're toxic from algae blooms, you're probably going to get toxic as well and get sick. So those are some of the ways you can get that in there. So Rebecca asked, what would you consider a SAD diet, standard American diet? High sugar, high bad fats, meaning more of the saturated, not as bad as we once thought, but still not great. Trans fats, which now are thankfully in processed foods being lowered. You can see how much trans fats are in there. But it's going to be things low nutrient, high toxins. It can be a non-organic diet, meaning you're eating foods that have a lot of pesticides. It can be eating a high number of sugary foods, sweets, refined carbs, leaving out the things that are good, adequate protein sources, adequate phytonutrients, a rainbow of colors. So typically that's what we see. Fast food, processed box food. If you've heard people say if you go to a grocery store, you should only buy food from around the corners. Don't buy it from the middle aisles, because typically the more boxed it is, the more problem it is. Not 100% of the time, but that's a pretty fair rule. Would be what I call a standard American diet. Not getting enough fish and eating grain-fed beef or grain-fed meats instead of grass-fed, whether it's chicken or beef. So those are some different things in that. How is leaky gut diagnosed? So leaky gut, as we talked about earlier, back to our initial topic, was the ability of things to get into your bloodstream through your gut easier because the barrier function is not working. We can diagnose it by taking a piece of your intestine, sending it to a research lab, and doing some special testing on it for thousands of dollars, which we never do. I said we could do that. I didn't say we did. So what we do look at, though, is history. If you're having symptoms that go along with that, we're very suspicious. You can do zonulin testing. If those levels are high, it's more likely you have leaky gut. We do food sensitivity testing. That if you have a lot of food sensitivities, IgG or IgE, it's more likely you have leaky gut. We're going to treat it as such. There's also, you can look at lipopolysaccharide, which is a bacterial toxin, or the antibodies to it. They're looking at that as potential places where you can test for it. So we use different things depending on what. You can do some stool tests that look for calprotectin, which is an inflammatory marker that's non-specific but helpful. So there's a number of things we can do from that, but if somebody comes in with a lot of the symptoms and the diseases that are linked to it, we may let's just do a 5-hour gut program and treat that rather than doing a test that we know is probably going to be there anyway. So Jesse, what causes leaky gut in infants who were breastfed for over 1 year and they have a healthy diet on solid foods? So sometimes it's genetics. There are some genetics out there where your gut is more likely to be unhealthy. It could be toxins that you're not aware of that someone is exposed to, an infant. It could be toxins in mom. One of the great ways for moms to detox is to breastfeed. Sad to say, I'm a huge supporter of breastfeeding, but if moms are toxic, that's why we try to encourage moms to wait for pregnancy until we've detoxed them if we know mercury or mold toxins or organic toxins are there, to make sure that they're getting those out so they're not sharing them with their child. We also live in a toxic world. There are toxins everywhere. Sometimes we can put our finger on what that trigger was, sometimes we can't, and sometimes we just have to work on making that child as healthy as possible. All right, the last one here, as we're wrapping up, what are your thoughts on adding UV lights to the HVAC units? So there is UV lights, ultraviolet, is the idea that you can use this light to sterilize. Yes, it does. I will tell you, it's not going to sterilize the air that's flowing through because it needs to be sitting there for an hour or two. So stagnant air, it can sterilize. What it can do is sterilize if you're putting in the unit where it's shining on the blades or shining inside the casing, inside the box. Should prevent as much mold from growing on the inside. But it's not going to filter. You still need air filters, carbon, HEPA, those type of filters to remove the particles. It's not, again, if you have mold growing in a duct, that air passing through it's going to pick up mycotoxins. If it goes through the unit and you've got UV light, it's not going to help. It will just help where that HVAC unit is directly, just like if you're in having that light in a TB clinic, tuberculosis clinic. It's not, if there's air blowing through, if it doesn't have time to hit that and sterilize, that air is still going to have those tuberculosis in it, same mycotoxins and mold spores. So it helps there, but not the air going through. So, all right, we have to wrap it up because I have patients that will be coming in this afternoon. So I enjoyed this time with you. Hopefully this was helpful. I look forward to 2 weeks from now, let me double check confirm what we're talking about in 2 weeks. I believe at Epstein-Barr, yes, Epstein-Barr virus, another virus that often wakes back up with mold toxic patients, so that's how it's connected. But we look forward on March 28th on a Thursday, talking to you more about mold and Epstein-Barr. Until then, you can leave more questions that we may try to get to them next time, but I enjoyed it, and I look forward to seeing you in the office. If you're not already a patient and you need our help, 615-815-5941. Or if you know someone who may need our help, we're glad to help them. So thank you, and it's been great. Have blessings.